Everybody, welcome to Verde Valley Caregivers Coalition. This is our initial training and orientation for virtual care assistants. And we will get into the very nitty-gritty details of all of that fairly soon with Heather Kurowski, who's our staff coordinator for that program. And we have Travis Bourne, who's in charge of virtual care for NAH. And so we're delighted to have him here. And he will show us all the details about how our collaboration will work with NAH to be able to provide assistance out there in the homes for people who need virtual care. And we can talk more about that throughout our training session today, about the pros and cons of virtual care and what is it going to look like in 5 years? Does anybody really know what healthcare is going to be like? And so we'll talk more about that too. And we'll have lunch, and I will leave at about 11:45 and go over to Wildflower and pick them all up. They may or may not have names on the lunches, so we'll just have to take a look and see what's what. So anyway, I just want to welcome you all, and we have two other staff here, and we have Mary Jane Thompson on our board of directors, and we have Linda Clark, our director of Development and Communications, and we have Karen Damiana, who's our Grants and Development Assistant.
Good morning.
And so we're all delighted that we're here today and being able to start this program. We have in the past have done a little bit of a pilot for this, that Heather went out on some of the calls to provide assistance in the home for virtual care. And it worked out really well, knowing that those appointments wouldn't have gone on at all without us being in the home with that individual. So we see a real role for this, and I'm so delighted. The retired nurses have done so much for Verde Valley caregivers, and especially for our older adults throughout the Verde Valley. You've been responsible for making the big difference for care transitions from 2012 through 2015, helping over 670 individuals who otherwise would have been definitely readmitted to the hospital multiple times in that first year after discharge, and especially within 10 days or so after their initial discharge. And we prevented that. In fact, for those 671 people we helped on referral from Northern Arizona Healthcare, the return to hospital rate was 1.8%.
Oh, that's good.
But the big deal, it was only 2.5% during that whole next year. So the point is, everybody was getting more attention from the primary care level of services. We made sure everybody got to every appointment. We picked up all the medications. We talked to them about it. We did the med reconciliation. We just paid attention, lots and lots of attention to them. And that really works. That's part of the role of virtual care. It'll increase the amount of attention primary health providers can give to their patients. And so we're looking forward to making a difference in that way now. And see, how many of you have enrolled as volunteers already for Verde Valley Caregivers? Okay, you all have. Oh,
I
you
did in
haven't.
the past, but I haven't been enrolled.
Okay, well, we'll get you a packet, and you can take that packet with you, and there's a form inside, an enrollment form for, Linda will get it. We'll make sure you have that so we can have you come back for an orientation regarding volunteering, and we'll get you signed up. So what we have basically is a process that Heather will go through for you in how we will do that referral. How will we work with you, and how does that happen? And we have a software called Assisted Rides, and every request we get a referral from NAH, and we'll put that in Assisted Rides as a request for help. Heather will coordinate all that and contact you as a volunteer and say, we have this request for virtual care assistance on this certain date for this person living in this area of Verde Valley. Will you help? And you would be assigned to that with a date, a time, and the proper equipment to help them in the home. And then Heather would be the person that you would work with to make sure there are no problems with that appointment, that you called the client early the day before to say, my name is, and I will be out there at a certain time to help you get set up, and plenty of time for the appointment. And then how that went. How did you think that appointment went? Did that client really, how did they benefit from it? Did they enjoy your company? We kind of see that'll probably be the biggest thing. Oh yes, I loved having that person in my home because I haven't had a visitor in weeks. And so that will all be very, very good. I think a really good part of this program. So we'll go through all those little details. We'll even show you assisted rides and what that looks like. And then we'll get you set up in assisted rides sometime very soon. We may want to call you back one at a time or whatever to have you in. But I think Peg and Jamie, you each saw the assisted ride system, did you? Mm-mm. Oh, you didn't? Okay. Well, Valoy will train you on that and make sure you get in there. You will have, each of the volunteers will have their own way, their passcode to get into assisted rides, and you can see the service request you've accepted. You can see a little bit about that information about the person you'll be going to visit. Are they ambulatory? Do they live alone? I mean, who will answer the door too? That's usually the first question I have when I'm going out there. And so you'll be able to see all that in advance and feel very prepared for that trip out to that person's home to be able to help them. I think that's all very, very important. And always keep in mind that Heather's available. You'll be able to contact her anytime with any questions. We won't leave you alone out there with this. We will be at your side, at least virtually, all the way through this, anytime you need us. So with that, I want to welcome Heather Kurowski, who's our care coordinator team leader, and she will go through all of these points you see, accepting assignment, the assisted rides and looking at that, and appointment verification, confidentiality, and any questions you might have. So Heather.
Thank you, Ted. Mm-hmm. Hi, everybody. I hope everybody's comfortable. Okay, I know it's a little bit chilly. I get cold too. I wanted to go over, let's start with what is virtual care. How many of you guys already are familiar with virtual care or have used a virtual care maybe for your own appointments in the past, or maybe have helped friends or family with virtual care appointments?
Yeah.
Jamie, do you want to tell me what you know about virtual care?
I had to do one with my dad, and all we had was my cell phone.
Okay.
I remember being kind of hard
Yeah.
with the cell phone.
What was hard about it? Just to see?
It was tiny, and he was visually impaired.
Oh, okay. Yeah, the
And
screen size.
Yeah.
Yeah.
You
Okay.
know, that was my only one time.
Yeah. Okay. Anyone else want to share about their experience?
I agree with what you said, the cell phone, I did helped several people with the cell phone, and it was very frustrating, but when we got to the laptop and used it for some virtual care, it really went neat.
It helped a lot with the
Yeah.
bigger screen.
Yeah.
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 Do you want to share? Did you experience?
Shortly after we moved out here, I contracted COVID.
Yeah.
I didn't have a primary care provider set up yet.
Mm-hmm.
And so I had to call my nurse practitioner back in Illinois. So we did a virtual care thing over the phone, and the only thing is you can't listen to heart sounds, you can't listen to lung sounds, and so that was frustrating. And being a nurse, I have 3 stethoscopes, They were all in storage.
Oh no.
I was just like, go figure, why did I
Not
do
very
that?
convenient.
Yeah.
Well, yeah, so being in a rural area, that is one of the hindrances, is we're limited on our healthcare here. And so sometimes the virtual is helpful in the fact that it does connect us to more providers outside of the area. So that's a perfect example of where you were able to connect to your previous, your other primary care and get that help that you needed for your COVID experience. So virtual care, let me start with my slideshow. Benefits of virtual care, so I'm going to go into that a little bit. Some of the benefits are nearly 20% of the U.S. population live in rural areas, but less than 80% of doctors and healthcare professionals practice there. With virtual care options, if a patient can find the service they need locally, they have the option of connecting with a specialist through any device with an internet connection. This enables individuals and families to receive healthcare and access to prescriptions without traveling long distance. There's no denying that virtual care provides patients greater convenience, more access to physicians and specialists, especially in rural areas, and lower healthcare costs. Another reason for the escalation in virtual care services is the decline in traditional access to healthcare in rural areas. What is virtual care? Virtual care encompasses the various ways doctors can provide healthcare services to patients through digital tools such as video calls, phone calls, instant messages, or remote monitoring, which may replace or accompany in-person appointments with a healthcare provider. With virtual options, if a patient can't find the service they need locally, they have the option of connecting with a specialist through any device with any internet connection. Virtual health visits increased drastically in the first months of the pandemic. There was a 57% increase in the number of individuals who opted to use them. Healthcare providers are seeing 50 to 175 times the number of patients through virtual visits than they averaged before the pandemic began.
Whoa, that's a big.
Yeah, so pretty impressive as far as, the numbers that virtual care is reaching. So it is very convenient and it gives people more access to healthcare, that's undeniable. Here's a video link. Let's see if it'll work.
Is it your first time seeing your doctor using virtual care online? When booking your appointment, you may be given the option to see your doctor virtually. Connecting with your doctor online is a convenient way to see your doctor. If you've ever had a video chat with your family or friends, a virtual visit with your doctor is a similar experience. If you're new to this process, this video will help you understand how it works. You may have questions around the security of discussing your health concerns over a video call. Your doctor's office will explain the process and may also ask you to provide consent to see your doctor virtually. Your doctor's office will provide you with instructions on how to prepare for your visit and how to connect with your doctor at the scheduled appointment time. You may want to ask a friend or family member to help you with your virtual visit, especially if it is your first time. If you want to include someone in your appointment, be sure to let the doctor know if anyone else is in the room with you. Join your virtual doctor visit using a device that you already have and are comfortable using, such as a smartphone, tablet, or computer. Ensure you are in a well-lit, private space. Ensure the device you are using is equipped with a camera and microphone. Check to see that your camera and microphone are working. Connect a few minutes prior to your appointment time. Be prepared for your virtual visit by having your questions for the doctor prepared ahead of time. Have the address and phone number for your preferred pharmacy ready in the event you may require a prescription. If you have prescription medications, keep them nearby for reference. When you join your virtual visit, you will likely be placed into a virtual waiting room. It will feel different than an in-person waiting room, but you're in the right place. The doctor will admit you when they're ready to see you. Remain patient in the event they could be running a few minutes behind schedule. During your virtual visit, you'll be able to see and speak to your doctor almost as if you were in the room with them. Your doctor may walk you through a self-examination. Certain situations may require follow-up after the virtual visit. If lab work or a prescription are required, your doctor will let you know how to proceed. At the end of your visit, simply close the window or application you are using to end your visit. Have a great virtual visit.
So I know Travis is going to go into that a little bit later as far as using the NIH tablets, and it's going to look a little bit different than that. I don't think that there's going to be that waiting period, but we'll talk about that later. So some in the video, it talked about how, some patients, they have friends or family members that can help them through this process. A lot of the older generation isn't comfortable using the technology devices that you need to make the virtual visit successful. And a lot of our neighbors, so I just want to clarify, we call our clients here neighbors. So a lot of our neighbors don't have the friends or family available to support them through this process. So that's where we would come in. We would be there to help facilitate and just make sure that it goes smoothly for those that, are isolated or don't feel like they have the support system that they need to make this happen. So we would come in and we would provide that support, and we would sit with them during their appointment if that's something that they're comfortable with. And we would help them navigate this virtual visit with their doctor or medical providers. So I want to go into assistive rides. So our assistive rides, I'm going to show you what it looks like. Okay, so assistedrides.com, there's no app for this platform. Unfortunately, yet you have to go through the website. What I did on my phone to make it more convenient for myself is I have a link on my home screen on my phone, so I can just click on the link on my phone on the home screen and it takes me directly to the website. So that's what I use because it's just convenient for me to already have the link right there, because I go on here on a pretty much a daily basis. So Assisted Rides has a login right here, which each of you will have a login here shortly if you don't already. So I'm just gonna put in my email address, which it's already saved, and then my password. Hopefully I'll get this right. With my long nails, it's kind of a hit or miss. Okay, so this is what our platform looks like. It should say Verde Valley Caregivers at the top. This is the dashboard. So if I want to, let's say we get a call through our call center, we get a call from maybe a medical provider saying, I wanted to go ahead and schedule for a client of ours. We have scheduled a virtual care appointment for them December 9th at 10 a.m. So normally there's not gonna be that short of a window. It's gonna be further out than that. That might be a bad example. But okay, let's go a month out. Let's say January 9th, 2023, we get a request for virtual care assistance. So service. So we go under here and we're gonna put in the neighbor's name. So for this case, I'm gonna do volunteer client. Okay, so it has their demographics here, previous requests. So I'm gonna go in, and this is not something that you guys are gonna be doing. You're not gonna be putting in the request, but I just wanted you guys to see what we do on our end. So we go under new request, and it's gonna be new service, not new trip, because it's a service request where we're not providing the transportation for them to get somewhere, we're going to them. So we do new service, and then I'm gonna put in the date, January 9th, good, it's not a weekend. And then I'm putting in virtual care assistance. And right here, I can put in the time. So this time is of the service itself. I'm gonna put in 10 o'clock. So that's not the time that you would arrive at the client's house or the neighbor's home. That's the time of their actual virtual care appointment. So you would call the neighbor the day before is our procedure. You would introduce yourself as a volunteer. You would say, my name is Mary Jane, and I'm gonna be assisting you tomorrow with your virtual care appointment. I just wanted to let you know that I'm happy to help you with your appointment. I'm gonna be there to support you. And also, you're gonna let them know, or what I do is I ask them, what time would you like me to arrive? Would you like me to be there a few minutes early? Would you like me to be there 30 minutes prior to your appointment so that you're comfortable? What time would you like me to arrive? Basically, I leave it up to them. So then and also the location is a factor, because I'm gonna take note exactly where each of you guys want to service. And if, let's say, Jamie, maybe you live in Cottonwood and you just want to provide the service for the Cottonwood area, I would absolutely respect that, and I would only assign you these appointment requests for your area. And I'll get into that a little bit more. But so this is what goes kind of on the back end. And so we're putting in the appointment, and then here, volunteer, I'm gonna assign it to myself. And then I don't really have to make a request comment because it's pretty self-explanatory. Here I have the option of putting in what kind of phone or email or text. I'm gonna say my cell phone. And that's it. Now that appointment is saved into our platform. It's in the website, it's in assisted rides at this point. So it's assigned to myself, and so I'll be able to see when I log in, I'll be able to see all of these appointments, and I'll be able to see the addresses of each of the neighbors. So then based on that information and the date of the appointment, taking into account if you guys are on vacation or if you're unavailable that day. We have some volunteers that they don't want to provide a service on a specific day. Like Wednesday, I'm busy every Wednesday, I'm teaching a class at the college or whatever I'm doing. We take note of that, and we create an actual profile for each of you guys. So you guys will all be in the platform. So then I assign it to you, and I will send you an email notification of that appointment. So it'll be in assisted rides, and then it'll also be sent to you through email. You will also have an opportunity to confirm that appointment so that I can see on my end, oh, they did receive that, they confirmed. Or you could just shoot me an email back after you receive the email. Hey, Heather, I got the request. Yes, I'm confirming. I can do that for you. So, I can go under, can click under the appointment. Right here is send me email with details, and right here is a button to confirm. Under here, I can change or remove volunteer. So once I assign this particular request to, let's say to Jamie, yes, Jamie confirmed she's available on January 9th at 10 a.m. It's in Cottonwood, and she would like to go ahead and do that visit. Then I'll just go under here and change remove volunteer from myself over to Jamie. So then that's all I have to do to assign it to Jamie. So then if I were to click on this send me email with details, it already has my email information in the system. So right now it's just emailed me right now. So I could go on my phone. I have Outlook on my phone with my work email. So what I do is I just go under my email and see if it'll pop up so I can show you. It'll show up as mail@assistedrides.com, and it'll look like this. I don't know if you guys can see that, but it will have all of the details of the request, and it will also have a section for trip note, so I could leave any detailed notes in there if I needed to for you for that trip. So that being said, okay. Also, another way for medical, let me go back a second. The medical providers are not the only ones that can make that phone call to us at our call center to request that service. It can also be done through the actual neighbor themselves. So neighbors can call and say, hey, I have this virtual care appointment. My doctor wants me to, have this virtual care, and this is the time, and this is, the date and everything. Give us all the details over the phone themselves. We also have an email account that is designated just for virtual care. It's virtualcare@vvcaregivers.org. And I will be checking that on a daily basis. So if medical providers, if it's easier or more convenient for them to just email me the appointment information, there's that form of communication available to them as well. Any questions on, we'll save questions for the end if you guys don't mind. Okay, I'll go back here. Okay, so an email is sent to the volunteer, which at that point you can confirm the service request. Okay, so as far as confidentiality, and I know HIPAA acronym is not correct, it should be 2 A's, not 2 P's. So as far as HIPAA, I know that you guys are, I shouldn't say no, I'm guessing that most of you guys are well versed in HIPAA. And as far as the virtual care assistance program, I would say just being aware of your surroundings, and if you're in a public setting, that personal identification factors, and just being protective of our neighbors' information. I know on my phone, because I use this a lot for work and, you know, it has information on here that could potentially put our neighbors at risk if someone were to get a hold of my phone. So I always have my phone, I have it secure with passwords. So if my phone were to fall into the wrong hands, it's my actual device is protected. Our smartphones are just like computers. I think it's really important to keep them protected. A lot of people, you know, have information in emails or even banking information. So I think just being aware of the information and keeping that information confidential. There's always exceptions, you know, if, you know, I am a mandated reporter. If I see something, you know, that I feel the neighbor is at risk or isn't safe, I will report that. So are you guys familiar with Adult Protective Services?
You're gonna have to explain what mandated reporter is also.
Okay. So
We're mandated reporters.
yeah. Does anybody want to answer that question? Does anybody want to share what they know about mandated reporting? If the person is at risk, self-harm, or if they've disclosed that if someone else is at risk, then you would want to report that. So my previous job, I used to work with children. I used to help kids in the foster system with individual and family counseling. Sometimes things would get passed on to me that that child was at risk. Abusive situation, I had to call Department of Child Safety and report that. So there's certain circumstances where we absolutely need to report for the safety of others or for the safety of the neighbor. Adult Protective Services is an agency, government agency that does protect our seniors. So if you guys see anything that needs to be reported, you can just go to me and I can report it. Yeah, just discuss it with me and I can decide whether or not we need to make that report. I think that it is important to be aware in the home surroundings, for that reason, because a lot of our neighbors are vulnerable. And sometimes we are the only set of eyes that are going to come into the home. So I think, just if you see anything, even if you're unsure, just talk to me about it. And I'm always available and happy to have that discussion.
And
Yeah.
you will,
Additionally, seniors are often the target of financial abuse. People,
Absolutely.
trying
Absolutely.
to pull the things on them. And the general guidance is, when in doubt, report.
Yes.
And the agency will sort all that out.
Yeah.
And then abandonment or failure to provide care is also reportable. Just
Yeah.
letting people lay and
Yeah. Thank
they're
you,
not,
Guy.
not getting care. Yeah.
and you will get back to us whether or not Adult Protection acted on it, because I'm a little shy of Adult Protection and how rapidly they work. So I assume that if we talk to you about an abuse situation, you will get back to us individually and say, yes, Adult Protection did this or that or whatever.
Absolutely, Mary Jane. I can give you a follow-up on that. Yeah. Case by case. Also, that being said, I just wanted to share briefly with a personal instance. So, yes, there are a lot of scammers out there, and yes, our seniors are very vulnerable when it comes to financial abuse, especially with all the scamming that is going on. So, I recently, I used Facebook Marketplace. I don't know if you guys are familiar. It's a great site for those of us that live in a rural area. So I posted something on there for sale recently, and I got a response from one person that said, "Oh yes, I'm very interested. Do you take Zelle?" And I said, yeah, sure, I can take Zelle. And they said, I'm out of the area, so I can't pick the item up right away. I can't pick it up until the end of the week. I'm going to send you the Zelle money now so that you can hold it for me. I just need your email address so that I can confirm with you that you received the instructions. So it was kind of like, oh, okay, what? I know that doesn't sound right. Like, I know I don't need to usually give my email address for Zelle. Like, you have your own, you can just use Zelle to, transfer money back and forth. And so I went along with it and I said, yeah, sure, here's my email address. So I got an email that had, first they sent me a screenshot of the money had been transferred into my Zelle account. It was $200. And they said, did you get the transfer? And I said, no, I haven't received anything. Then I happened to check my email, and the email was in there that said, the money is on hold because you don't have a business account with Zelle, and you're going to receive another $200, and then you return the original $200. And then on top of that, there was another scammer the next day that did the same thing, and I feel like they were in cahoots and trying to make it look more legitimate because they probably sensed I was very leery. And so it can be very tricky to navigate, even for somebody such as myself that is in this kind of arena all the time and is dealing with scams all the time. So if I would have sent them the $200 back, I would have just been out of $200, right? So, yes, this population is very vulnerable, and if we see anything concerning, I think it's important to just bring it, into the open, and so that we can address it as a team. Follow-up surveys. So I don't know where Karen went, but she has some handouts over there, Mary Jane. If we want to just pass those around, these are just they're surveys that are in extremely draft form, and we just wanted to give you kind of an idea of some valuable information that we want to gather from these appointments so that we can provide better services in the future, and also so that we can keep improving as an agency to make this experience as successful as possible. So again, this is just very draft questions. Surveying, I think, is important. We're always trying to improve and get better, and so just taking the time after each appointment. I know Travis probably may be going into that a little bit later, but this is a paper form. There are digital forms also where you can just answer the questions maybe on the tablet or through Google Forms. I don't know if you guys are familiar. But this is just an example that, we really do value the feedback, and we are planning on collecting information after each one of the virtual care visits.
We asked them 1 through 7 and then put the number at the end of the sentence. Is that what you want us to do, or do we leave this with them and they send it in with what?
Either way, Mary Jane. So that's a good question. So yes, on each one of these, you would answer 1 through 7, whether the answer is 1, strongly disagree, 2, disagree, neither agree or disagree, 4, agree, or 5, strongly agree. This is subject to change. If the neighbor is not comfortable answering these questions in front of you, they absolutely can mail them in. There's, you just, wherever they're at, you meet them where they're at. So if you discover that there's any kind of hesitancy, or if they're starting to feel a little bit uncomfortable answering these questions in front of you, there's definitely other options.
I didn't get that.
Oh, I'm sorry. Okay, so I am the virtual care project manager, and my email here
The
is
same thing.
Heather Karowski at vvcaregivers.org. That is a great way to reach me. And if you guys have any questions after today, please email me those questions. I'm happy to try to answer them the best that I can and am able. Are there any questions for me as of right now today?
I have a question about
Sure.
using your phone
Yes.
confidentially.
Yes.
Would it be easier, I mean, just from your experience, would it be easier for me to use a whole different browser for all of my VVCC stuff?
That's totally up to you. So if you want to use like Firefox or Google Chrome, or if you want to use one of the other,
I'm just thinking in
is that
terms
what
of
you're-
keeping it separate so that I don't have to scroll through a bunch of stuff and.
Oh, are you talking about an email, like having a separate email for just?
I'm not sure how I want to do this because
Okay.
I'd really kind of like to make it faster, but yet also,
So we can talk about that later.
Okay.
Yeah, I'm happy to explore, how you can personally be more organized and have easy access to what you need to make it more convenient for yourself.
okay.
I thought one of the ideas that you had brought up was a great idea. You can actually save a website like an app on your phone.
The link.
The link
Yeah, I
itself,
could-
to where you just click on that, what appears like an app, but it's pointed up in a web browser itself. So it goes directly to that site. That may be a really great way to do that.
Just to keep everything within there.
Yeah.
So I can show you guys on my phone. I don't know how well you guys can see this, and just ignore the picture in the background because this is my personal phone. I don't have a work phone. So right here is assisted rides, and it just has like their little icon right there, and I just click on that. And I use Samsung products, so it takes me to the through the Samsung internet, and then it just opens up like this, log into assisted rides, and then I just put in my email and my password like that. So instead of actually going into like the Google search engine and putting in the website and then going that route, this just saves me that step.
Okay.
So it's just one button, takes me straight to the login, put in my login, and then I'm in.
Okay.
I'd like that in writing.
Okay, I can email you all instructions step by step how to do that.
That'd be great.
It's very simple.
When the system sends us an email, there's a link to click and you're there anyway, right?
Yes, yes.
That's my preferred method.
Yes.
Just the email comes, you get an email, you click, you're on.
Yes. Thank you so much for
Yeah,
sharing.
that's the my easy method.
How about
Yeah.
both of those in writing?
Okay. Okay, so another little trick that I can share with you guys that I use. So I use Google Maps for directions, right? And so for my GPS, I always have the person's address that was sent to me through my email for the service request. I click on the address in my email and just hold it down. So I'm on my phone, right? This isn't gonna work, because it's easier on my phone because then it goes straight to my Google Maps. If I just hold down that address, it'll open up a little window and it'll say Maps. Click on that, takes me over to Google Maps, and then already puts in the address for me. So that way it pops up and I have my navigation how to get to that person's home. So I can put that in email also, like that's just the trick that I use.